Right now, 78% of hospital beds across the state are full, with 36% of ICU beds occupied by COVID patients. Healthcare workers say they are overwhelmed tonight. Channel 3 Eyewitness News reporter Sharon Johnson tuned into a discussion with ICU specialists. Sharon, what do they have to say about the status of local hospitals?
Well, Mark, a doctor with Yale New Haven Hospital says that they are so busy. Some patients are waiting up to 24 hours for a hospital bed. They say they're not at capacity yet, but they're definitely feeling the stress of this second wave.
We're not even at the depth of what we think will happen this winter. And we're already forced to make choices in terms of deciding who's coming to the ICU.
It's the second round of a nightmare healthcare workers thought they conquered months ago. This time, doctors with the Yale New Haven Hospital say it's even more heartbreaking.
What I've seen now and I've never seen before is just how overwhelmed people feel. Because of the hours, because of the nature of the responsibility, because of the fact that it's back again.
Today, State Senator Saud Anwar hosted a Facebook Live with 3 physicians from Yale New Haven Hospital. The staff gave vivid accounts of what it's like behind closed doors, battling COVID-19 face-to-face.
The ICUs are closed. People are not seeing the misery and the pain inside, so they actually have no idea about it.
The physicians say it's more than the horror of battling the cruel disease. They say the long hours, residual trauma, and isolation for both staff and COVID-19 patients are also taking a mental toll.
I FaceTimed her from my cell phone, and her daughter was singing to her and saying prayers and sharing stories, and my hand was trembling because I was just crying, bearing witness to this, what was happening.
With beds filling up again, the physicians also discuss space having an impact on the type of care patients are receiving.
Patients are waiting for hours on the floors, unable to get the level of care that they need, in the setting that they need because of this.
The physicians say they want people to continue to protect themselves by wearing masks, social distancing, and only being with people in your immediate household. But they say they also need assistance from the local and federal government before this wave gets worse.
We really are hanging in there, but what we want to do is to do whatever we can to get to a point where things really get out of control. We're not there, but that's what we're trying to prevent.
And the doctors say that some healthcare workers have been working weeks on end without a day off. And they also want people to remember it's not just doctors, it's not just nurses, but it's custodians, it's cafeteria workers, and other staff members who are at the front lines. Live in the mobile newsroom tonight, Sharon Johnson, Channel 3 Eyewitness News.